Good evening, everybody. First misconception about infertility is that it's a woman's issue. Just an interesting comment. Forward-looking statements. Just a general introduction. We are a public company under IVOB. We did a reverse merger in late last year in December, and we're just actually starting to launch our first product. We are a medical device company, and we have a device to help treat infertility that is a lot simpler than going through traditional IVF, is a lot more affordable than going through traditional IVF, and it can also be made more geographically available because it can be done in an OBGYN's office versus being done in a large infertility center. This is just a graphical of what our device is. It's this size right here, and the concept of our device is that we use a low stimulation protocol so women produce less eggs than they do in IVF, and the oocytes are retrieved, the male sperm are taken from the male, and they're actually put inside our device instead of in a petri dish in an IVF center. And once it's in that device, the device is actually placed intravaginally up behind the cervix for 3 days. The science behind this is for fertilization and embryo development to take place, it has to be in a 5% carbon dioxide environment, and it has to be at body temperature. And the upper vaginal cavity is just that. If you're in an IVF center, they are artificially controlling that by putting 5% CO2 in an incubator and keeping it at body temperature. And in an IVF center, every time they open the incubator doors, there's temperature variations, and all these things need a lot of controls. They need backup systems. And with our device, you don't need the lab. So it makes it a lot more available all over the world so that OBGYNs can treat infertile couples, not just infertility specialists. In INVO cycle, we are actually marketing and selling not just the product, but a procedure, because the procedure is somewhat different than IVF. We used mild ovarian stimulation. They retrieved the oocytes under conscious sedation, which generally was traditional IVF because they're retrieving so many oocytes that they have to use general anesthesia. The vaginal fertilization and embryo development happens in the woman's body, so it doesn't, you don't need the incubators. It goes for 3 days, and then after 3 days where the device is actually taken out of the female's body, the resulting embryos will be in the bottom of this small device where under the microscope you can actually grade the embryos and pull the best 2 embryos to transfer right from the device. So the procedure is very simplified. We have, in all the studies that we've done thus far, we have the exact same efficacy rate as traditional IVF. There's 800 published cases at this time demonstrating this. We have a lot lower cost to achieve pregnancy. For OBGYN to be able to do the INVO procedure, they have to have 3 things: an ultrasound equipment, which most of them have, a microscope, which most of them have, and a desktop incubator. And other than that, it's the peripheral catheters that you'd use in IVF. So it's very inexpensive for an OBGYN to be able to treat patients. Where to set up an IVF lab, they run anywhere from $500,000 to $1 million just to set up the equipment and the space and facilities for an IVF lab. And that's what drives the expense of the IVF procedures. The greater geographical availability, right now we're launching in what we call the low-hanging fruit areas, and it's countries that just don't have options such as IVF, where there's millions of infertile couples, and that's where we're starting to launch product right now. The other thing that we're getting a lot of feedback as we started in the field is women are very comfortable knowing that their gametes are being fertilized and their embryos are being developed inside their body. They don't have to leave them in a lab somewhere where they are afraid that it could get mixed up with somebody else's. They always have those gametes with them. It never leaves their side in the procedure, so there's no chance of mix-ups. Cost per pregnancy. This slide is telling us if you go through IUI, it has a 10% efficacy rate. And even though it's less expensive, by the time you reach pregnancy, it's still going to cost you $12,000. So that's the cost per achieving a successful pregnancy. With INVO at a 24% pregnancy rate, it comes out to be $12,500 per pregnancy, and with IVF, it's $21,354 per pregnancy. So that's 4 successful pregnancies. Taking a look at the U.S. stats data, where the numbers come out. So it makes a lot of sense to go through fewer cycles of INVO in getting pregnant than all those cycles of IUI that aren't very successful. Our market strategy is that we're not competing with IVF. There are over 150 million infertile couples in the world, and that's according to the European Society of Reproductive Endocrinology. Out of those 150 million people, 0.5% get treated. So in this world right now, 99% of couples that suffer from infertility do not get treatment. They want to have a child, they can't have a child. And the reason why is because it costs so much, and people just don't have access to it. So what we're doing is we're not trying to compete with the IVF centers. They just aren't in the market enough for us to even want to compete with them. What we're trying to do is get into the marketplace where all these patients are that do not have access for treatment and cannot afford treatment. This lower cost of our procedure will allow people that go through IUI because it's very inexpensive to go through INVO first, because IUI does not work for blocked tubes and many other indications that cause infertility. Oops, wrong way. Sorry. This is talking about the market opportunity, that 150 million people, and 0.5% get treated. About 1 million cycles are done a year, and the average woman goes through 2.2 cycles to achieve pregnancy. And with all those people out there, it's because of cost, availability, and awareness. This is an example of the market opportunity. In the EU, there's about 10 million infertile couples. In the United States, 7.3. Latin America, which we're actually down there right now doing 2 large workshops training physicians as we speak, 1 million. And if 500,000 get treated, if 0.5% of these patients get treated, this is what the market opportunity is. When INVO Bioscience even treats 5% or gets access to 5% of that market of unmet patients, we're into the billions of dollars in revenue. So the market's wide open. In Europe, we have received our CE mark, so we do have authorization to market in Europe. The FDA has reviewed our entire 510K, and we went back and forth. We answered all their questions, and they have come back and asked us to do a clinical trial of 75 patients. We have not done that yet because the trial is going to cost us about $1 million. So we want to get our market started outside the U.S. before we move forward with that study. But we do have an open IDE for the study with the FDA to start the study when we have the dollars to do it. Our market selection so far has been taking a look at the population size and statistics, so we know what large populations are, which populations do not have access to infertility, what markets have gamete handling regulations that we have to deal with, because some don't care. Some countries and others have regulations on how, if you can retrieve oocytes, or if you can freeze embryos, and all these sorts of regulations, and the prices of the reproductive technologies. In the United States, the average cycle for IVF is $12,400 per cycle. So, and I think most people in this room, I would be surprised if anybody does not know somebody that's gone through an IVF cycle or some type of assisted reproductive cycle. Our sales timeline, what we're seeing in the marketplace, because we are developing a new market, is that we have been identifying a key opinion leader, a physician in each country that wants to adopt this procedure. And what these physicians have been doing is running test studies of the first 30 patients so they can publish in the country to their peers and say, this is how this works, and be the leader for us. So we're just going through the training curve of getting our distributors online, our physicians online, and starting to train physicians in different parts of the world. Ramp up sales. Right now, the first country we actually started selling in was Turkey. We started doing cases in there in 2008. We have 8 INVO centers, and these are OBGYNs who have opened INVOcell centers in the Middle East right now.